Hello everyone. In this section, I'll discuss about the cross features of ovary and fallopian tube. Okay, here you are seeing this is the posterior view of this female reproductive organs. You can see this is the uterus. This is the vagina. Okay. Then here you can see this is the uterine tube. This is the ovary. This is a broad ligament. Okay. The parts of the uterus, this is the fundus, this part is the fundus, this part is the body. Here you can see this is the cervix. See, this is the vagina from behind. Okay. See, this is the broad ligament, this is the peritoneal fold. In the last section I have told about the features of this broad ligament. It has two surfaces, anterior and posterior. What you are seeing here, this is the posterior layer of the broad ligament. There you can see this is the ovary, okay, with this fallopian tube in this upper part of this broad ligament. Okay, so now I'll see about the features of this ovary. Here you can see this is the sagittal view. This is the anterior aspect. This is the posterior. We can see this is the vertebrae and this urinary bladder. This is the uterus. See the fallopian tube with this ovary. Okay, it's in the pelvic. This is in the location that is in the lesser pelvis. Okay, it lies over this walls of the pelvis. Okay. Then see here you can see anterior. This is the anteriorly some vessels, that is the external iliac vein and artery will be there. Posteriorly there you can see this is the ureter is coming and there is the ovarian artery and vein there. Okay. Then so the ovary lies in the lesser pelvis. In the ovarian fossa, it rests over in the posterior, it rests over the pelvic wall. That region is called the ovarian fossa. So location of the ovary, that is in the ovarian fossa. Okay. In this figure, you can clearly see the boundaries of this ovarian fossa. Okay. See, this is the ovary, this is the uterus. Okay. The boundaries of this ovarian fossa, this is the right side. Okay. See, this is the abdominal aorta. It divides into right and left common iliac. This right common iliac divides into right external iliac and this one right, that is the internal iliac artery. Okay. See, this one is the common iliac vein. Okay, this is the external iliac and this is the internal iliac. This external iliac and internal iliac joins to forms this one. Okay, of both sides of this common iliac vein. Okay, so this is the abdominal aorta. This is the right and left common iliac. This is divides into external iliac and internal iliac. See, this is the anterior of this ovary. Okay, the surface you are seeing, this is the medial surface. Behind that is the posterior surface where it lies. Okay, that is the ovarian fossa. So boundaries of the ovarian fossa, anteriorly you can see this is the external iliac vessels. Posteriorly, see this ureter is going posteriorly. Posteriorly, this ureter and this ovarian vein and artery. This is ovarian vein, ovarian vessels posteriorly. See, also laterally, this surface is medial surface. It rests over the lateral. Okay, laterally, that is not there in this figure. There we get the obturator nerve and vessels. This obturator nerve, okay, if there is any inflammation or if there is any enlargement of the ovary, there will be the compression of this obturator nerve, which produces pain over the upper medial side of this thigh and the knee joint. Okay, that you should know. Okay, that's about the boundaries of the ovarian fossa. Okay, then this figure you can see this is the posterior aspect. Okay, this is the posterior aspect. Here you can see this is the left side, left fallopian tube and left ovary. You can see here. See, this is the fallopian tube. Okay, this is a broad ligament. Posterior layer of the broad ligament, can see this the ovary. Okay, see it has two ends. This is the upper end, this is the lower end. This upper end is also called the tubal end. Okay, where this uterine tube attach. Okay, this is the lower end. Lower end is attached to this lateral angle of the uterus, okay, by means of the ligament that is called the utero-ovarian ligament or the ligament of the ovary. Okay, then see this is the suspensory ligament. Okay, this upper end is attached to this lateral pelvic wall by means of a peritoneal fold that is called the suspensory ligament. Through that ligament, okay, this ovarian artery and vein goes. Okay, so ovarian vessels, so it is ovarian artery is coming through this ligament through this anterior border of the ovary and supplies this ovary. See, this is the anterior border, okay, where you can see the ovarian vessels. So this region is also called this hilum of the ovary. Okay, that is the anterior border or hilum of the ovary. Okay, then see this is the posterior border that is free. Okay, then which surface you are seeing, this is the surface, this is the medial surface. Okay, it faces medially. The where it rests behind, that forms the lateral surface. Okay, that is the ovarian fossa. Okay, that's all about the parts of the ovary. Okay, parts with relations. Then this figure also you can see this is the posterior view. Okay, this is the posterior view. Are you seeing this the posterior view? First figure, this is the uterus. You can see this is the fallopian tube, ovary. See here, this is the uterine cavity. Here you can see the fallopian tube, this ovary, this is the vagina, can see. Okay, see the ovary in the nulliparous women. Okay, this ovary is in a horizontal, vertical position, nulliparous. In multiparous women, it is in a horizontal position. Okay, multiparous. And also the ovary, before puberty, it appears as pinkish gray in color. After puberty, it appears as gray in color, and also the surface becomes rough due to the repeated ovulations and the degenerations of the follicles. Okay, the dimensions of the ovary, that is the 3 into 1.5 into 1 centimeters. Length is 3 centimeter, breadth is 1.5 centimeter, and thickness is 1 centimeter. This is the average dimensions of the ovary. Okay. Then here you can see this is the blood supply of the ovary. See here, this is the uterus, this is the vagina, fallopian tube, ovary, can see here. Main supply to this ovarian artery. This ovarian artery is a branch of the abdominal aorta. See here, you can see this is the uterine artery is coming, uterine artery. It is tortuous, okay, this uterine artery, okay. That is because when the uterus enlarges in the size during this pregnancy, okay, to compensate, to give sufficient blood supply, the uterine artery is tortuous. That means it can also dilate. Okay, when the size enlarges, the artery also dilates and gives the corresponding organs sufficient blood supply. Okay. Venous drainage, that is to the ovarian vein. See here, you can see this is the ovarian vein is there. Okay, the ovarian veins, there will be the right and there is the left. Okay, so this is the posterior view, this is the right, this is the left. Okay, so there is this right ovarian veins drains into the inferior vena cava, and the left ovarian veins drains into the left renal vein. The final drainage is different in the right side and this left side. Okay, so blood supply, ovarian artery, uterine artery, venous drainage into the ovarian veins. Then here you can see this is the lymphatic drainage to this nodes in the anterior of this aorta and the lateral, that is the pre-aortic and lateral aortic nodes. Nerve supply, it is sympathetic, T10 and T11 segments of the spinal cord. That's all about the features of the ovary. Next, here you can see this is the fallopian tube or the uterine tubes. Okay. Here also you can see this is the broad ligament, this is the posterior view. See the uterus, this is the vagina, fallopian tube, and this is the ovary. Okay. See the fallopian tube on the right side, see here, there is an opening towards the pelvic cavity. Here it communicates, this is the pelvis. Okay, that is the lesser pelvis, opening to the pelvic cavity. This opening is called the pelvic ostium. That opening is called the pelvic ostium. Here it starts, then it communicates with this uterine cavity. This opening here, that is called the uterine ostium. Small opening, that is the uterine ostium. Towards the uterine cavity it is communicating. That is 1 mm in diameter, this uterine ostium. See this pelvic ostium, this is 3 mm in diameter. Okay, you can see here this opening pelvic ostium, this is the uterine ostium. Then next is the parts of this uterine tube. Okay, here you can see this here you can see the parts. Okay, this is also the posterior view. Okay, see this is the fundus, this is the body, this is the cervix. Okay, see this is the fallopian tube or the uterine tube. Okay, broad ligament with this ovary. Okay, then see from medial to lateral, the parts are the first, this is the wall of the uterus. Okay, a small part you can see in the wall of the uterus, that is called the pars uterina tubae or the intramural part. It is 1 centimeter in length. Next comes the cord-like part, like this, a cord-like part, that is called the isthmus. Okay, its diameter is that is the 3 centimeter. Then comes a dilated part. See, this is the dilated part, that is the ampulla. Okay, its diameter is 5 centimeter. Usually fertilization takes place in the ampulla, then it moves and gets implanted into this posterior wall of the uterus. Okay, upper of this body of the uterus. Okay, implantation takes place. Okay, then next part of the uterine tube, there is a funnel shaped part, that is called the infundibulum. This infundibulum is showing numerous processes. So you can see numerous processes. Those are called those are called the fimbriae. This fimbriae. See, one fimbriae is long and is attached to this ovary. That fimbriae is called the ovarian fimbriae and is attached to this tubal end or the upper end of this ovary. That is called the ovarian fimbriae. So these are the parts of this uterine tube. That is the pars uterina tubae or intramural part, then isthmus, ampulla, infundibulum with the fimbriae. Okay. So total length is 10 centimeter. Okay, this infundibulum is also 1 centimeter in length. Okay. Then here you can see the relations of this uterine tube. Okay. This is also the posterior view. Okay, see here, this is the fallopian tube. You can see below the fallopian tube, you can see there is the anastomosis of this uterine artery. See, it is tortuous uterine artery and this ovarian artery you can see. Okay, below, and also there is a round ligament is there below this uterine tube, that you know in this round ligament we already discussed in this uterus. Okay, then additional to that, you can see here, this is the ligament of the ovary. That is the ligament of the ovary. Okay, these are the structures which lies below the uterine tube. Then see here, you can see here in the lower part relates to the cervix of the uterus. There is a uterine artery and ureter there. Ureter lies posteriorly, and uterine artery crosses from lateral to medial. Is to the anterior of this ureter, this uterine artery. Okay. See here, you can see this is the ureter, this is the uterine artery. Okay. This uterine artery crosses from lateral to medial, to the anterior of this ureter. Okay. Then, so while during hysterectomy, okay, removal of this uterus, one should be careful, okay, about avoiding injury to this ureter while clamping the uterine artery. Okay, that's about this relations of this uterine tube. Then the artery supply is the same like ovary. The blood supply, that is the artery supplies the ovarian artery, uterine artery, venous drainage to this ovarian veins. Okay, lymphatic drainage to this pre-aortic and lateral aortic. Then nerve supply sympathetic T10 and T11 segments. Parasympathetic, that is through the pelvic splanchnic nerves. Okay, that's all about the features of this fallopian tube or uterine tube. Okay, hope you understood. Okay, you should write answer for this in your assignment book. Describe the gross features of ovary, which are the first about this location, its parts, blood supply, nerve supply. Okay, applied aspects I'm telling in the next section. Okay, then gross features of fallopian tube, it's the parts of the fallopian tube and the relations along with its blood supply. Okay, thank you.